Hyperthyroidism, what is it? Hyperthyroidism, which is prevalent in about 1.3% of the population, is somewhat less common than hypothyroidism. The prevalence rate does increase with age, and older women have a 4 to 5% incidence of an overactive thyroid. What follows will be a discussion of hyperthyroidism, what it is, what causes it, and what treatment options are available to treat the condition. Characteristics of hyperthyroidism. Hyperthyroidism is the condition of having an overactive thyroid that overproduces thyroid hormone because the thyroid gland plays a major role in body homeostasis and metabolism. A dysfunctional gland can result in various complications causing significant symptomatology. The various risk factors for hyperthyroidism include age, sex, family history, personal health, and being pregnant. While hyperthyroidism generally refers to an overactive thyroid, there are some different medical conditions that lead to hyperthyroidism, and they are as follows: Graves' disease, thyroiditis, a temporary cause of hyperthyroidism, toxic multinodular goiter. Graves' disease. The most common cause of hyperthyroidism is an autoimmune disorder involving thyroid antibodies that stimulate the thyroid to overproduce thyroid hormone. The typical finding in patients with Graves' disease is protosis, which is marked protrusion of the act caused by swelling and fibrosis of the muscles around the eyes. Thyroiditis is usually caused by a bacterial infection and will require treatment with antibiotics and possible surgery. If an abscess develops, toxic multinodular goiter is a condition in which many nodules are found in the thyroid gland. And hyperthyroidism is often present like hypothyroidism. Hyperthyroidism is also often categorized or distinguished by primary and secondary hyperthyroidism. The former is when the pathology is triggered within the gland itself, and the latter is when the pathology is triggered externally by excess thyroid-stimulating hormone, TSH. TSH excess can be the result of pituitary adenomas, which are neoplasms of the pituitary gland. Pituitary adenomas are very rare, causing less than 1% of all cases of hyperthyroidism. Causes and complications of hyperthyroidism. The potential causes of hyperthyroidism are specific disease processes and autoimmune conditions, side effects of medications or supplements, and benign tumors. The following are some specific causes of hyperthyroidism. Iodine excess thyroid tumor, some pharmaceutical medications, epiprostenol, amiodarone, some medical supplements. Conditions that cause hyperthyroidism: Graves' disease, thyroid nodules, chronic autoimmune thyroiditis, hashimotosis thyroiditis, inflammation of the thyroid. Thus, hyperthyroidism can be caused by autoimmune conditions, nodular growth of the thyroid, infection of the thyroid, or by the side effect of certain medications. In addition, hyperthyroidism can be caused by increased production of thyroid-stimulating hormone TSH from the pituitary gland, otherwise known as TSH-induced hyperthyroidism. As hyperthyroidism persists, complications are likely to develop. The potential complications of hyperthyroidism include bone weakness, vision impairment, skin irritation and swelling, heart dysrhythmias, hair loss and nausea. Signs, symptoms and diagnosis of hyperthyroidism. The signs or symptoms of irregular heartbeat, restlessness, inability to concentrate, muscle weakness, breast development in men, dizziness or shortness of breath can be findings in people who have hyperthyroidism. Evaluation by a medical professional will include medical testing of blood levels of thyroid hormones such as T4, T3 and T levels. This information helps to determine the diagnosis. Other tests using ultrasound, CT scans, nuclear medicine scans and MS may also be employed to determine if the thyroid gland has any abnormalities such as tumors or areas of abnormal hormone production. Further diagnostic modalities include fine needle aspiration of thyroid nodules to determine the characteristics of the tissue in the nodule. Treatment for hyperthyroidism. The goal of treatment in hyperthyroidism is to restore normal circulating levels of thyroid hormone. The specific causes of hyperthyroidism will guide the treatment. It may be necessary to consider an alternative if a particular treatment is unsuccessful. The following are the most commonly used treatments for hyperthyroidism: antithyroid medication, proposed thiouracil carbimazole mayo radiotherapy, surgery to remove all or part of the thyroid gland. Beta blockers. Propranolol antithyroid medications work by interacting with iodide pathways and by interacting with thyroid. This mechanism helps to normalize thyroid hormone levels. Effectively, radioiodine therapy and surgery are effective in destroying or removing the thyroid tissue which produces thyroid hormone. Thyroid hormone levels must be closely monitored and replacement therapy with thyroxine must be started if low levels develop. Final thoughts. Hyperthyroidism is a health condition that can trigger several unpleasant signs and symptoms. However, with timely and effective treatment, symptoms can be managed and lead to resolution of the condition. In addition, some mild cases of hyperthyroidism may resolve themselves without the need for treatment. Therefore, while the long-term outlook on the condition depends on the severity and cause, the general outlook is optimistic. The thyroid gland is essential in body system mechanisms and alterations in thyroid hormone can be debilitating. Therefore, evaluation for thyroid conditions is a critical part of living a healthy life and it should be a standard part of health evaluation in adults. Thanks for watching. Ellen and Michael Moriarty, 2 RNs.